Yes, I am Dr. Bhojraj, consultant spine surgeon at VN Desai Hospital, Lilavati Breach Candy. And more important, I am part of the Nina Foundation, one of the former trustee founder members, you can say. And I am very happy to be here on 25th June, which is our foundation day, and which is a big spinal cord injury once a year event. I am more happy today because I think for the first time we, and especially I think Ketna, has thought of this unique concept of having a clinical evaluation session, which I think is the most important event of the day-long function, because Nina Foundation is all about caring for the spinal cord injury patients, and if you come and see here, that's what is going on, which is much more important than what's going to happen in the evening. I'm not saying that's not important, but this I think is the crux of it all, that we are here. The patient basically comes here to have care taken on different fronts. One is the spine, one is physiotherapy, urology management, bed sore management, psychological issues, social issues, and all of us, and especially Ketna and the others in the organization, have managed to really gather all of us under one roof. And once a patient comes in, he's sort of taken through all these specialties and he really feels satisfied that all aspects are taken care of. We as spine surgeons are very focused on doing something for the spine, and as I was taught during my training, the problems of the spinal cord injury patients start after the spine is taken care of, because that's only the beginning of the battle. So here we were doing a holistic or a complete management or evaluation of a patient, and I am extremely happy to be associated with this event. And I feel this should form the crux or the most important part of future spinal cord injury functions and foundation days. And as I see it, this is going to be gaining more and more importance, and I think very soon we're going to have one day, maybe before the spinal cord injury day, the whole day dedicated to this, because as I found today, the time was not enough, because patients are wanting for more, and although I could finish a lot of patients in quick time, the other aspects which need detailed evaluation, that the physiotherapy, the urology, because they want to go from here having most of their problems sorted out. I think eventually we'll have to, and I see that more and more patients will get registered for this. It's a unique opportunity to get access to all top facilities or specialities under one roof on one day, and this should be be one of the most important functions or satellite events of the spinal cord injury day. So I would request the management to keep this as a main thing, and maybe if we have more people registering, because there is some time required for all this, so if it's logistically not possible, then we can extend this over the entire day and we can have it one day before the spinal cord injury function, and we could present the outcome of this on the spinal cord injury day on the next day as to what we achieved, because someone could analyze it and present. So the whole function could be very meaningful, and then we could follow up and things like that. So I am extremely happy to be associated with this function. What we also found that we had a good cross section of our country here. We had people coming from Jammu and Kashmir, interiors of Maharashtra, interiors of UP, Andhra. We had a girl from Andhra. So basically it's a good cross section of the entire country, and people from all over where they don't have access. They have to, some people have to travel miles or hundreds of miles to reach one doctor. Here under one roof they are exposed to the top people in all these 5 specialties which are necessary. So although this is a beginning, I can already see that the concept is in order, and this could become one of the most important events. And if we advertise it through our bulletin and through our media, then we would have more and more people registered. And as you all know, we are looking for instituting and starting a good rehab service in our city, and this could become a very important beginning for such an activity, and we could get focus or attention from people all over in planning such an activity. And this rehab center would obviously have all these 5 or 6 specialties, as we can see them all here available to us.